Good morning. My name is Keith Lemmer, President of WellNet Healthcare. And for those of you that were with us this past month on our health plan, our small group webinar, thank you for rejoining us today. For almost 20 years, WellNet has continued to dedicate itself to identifying the root of the healthcare cost problem. And workplace wellness is no different. Sustaining an effective wellness initiative, no matter the size of the employer or how success is actually defined, requires a collaborative effort at every stage of the life of the program. Today I'm joined by one of the brightest clinical minds in wellness and care management, my associate and registered nurse by training, Judy Mueller. Judy leads the clinical team within our engagement division. This morning, Judy and I will be discussing total population health management, workplace wellness that actually delivers. Today's topics, and we have 6 of them. What is traditional workplace wellness? What's the client and member experience look like with our program? What's the total population health management opportunity? And how do we support our partners, our broker and consultant partners that we work with day in and day out? And the next steps along with Q&A. To the right of your screen, you'll see a dialog box. Should you have any questions, feel free to type them in, and we will do our best to get them answered at the end of the presentation. Traditional workplace wellness barely scratches the surface. If you look at this infographic of 3 bridges, this image tells an interesting and a realistic story. At the bottom, you've got the large national health insurance carriers. They do a great job in paying claims, providing access, and moving a few levers for plan design. But at the end of the day, they're motivated by premium protection, and they offer, and when they do offer it, limited plan design options for disease management, and also various suspect wellness programs that have limited and lackluster results. If you look at the second bridge in the middle, the external disease management companies and wellness organizations, they're hampered and restricted by their access to data and their inability to get real, timely information, both of which lead to limited or subpar engagement results. At the top, workplace wellness done right, and this is really where WellNet bridges the gap. It requires the integration of clinical data, wellness, health coaching, and workflow processes. All these things working in real time, wrapped with incentive management for the purpose of engaging the right people at the right time with the right message. This is the definition of population health management. Whether it's public, private, or nonprofit, these companies have been relying on many of the well-known carriers, administrators, and other entities to reduce and manage their healthcare costs. That is, until WellNet came along. Whether you're looking at groups like Kiplinger Finance, that formerly used Blue Cross, Cantor Fitzgerald, that was working with Aetna, or Lamb Research, that was with Cigna, all these groups have one common theme, and that they selected WellNet to strengthen the roots of their entity, to be able to get inside to determine where the weaknesses, the challenges, and most important, the areas of opportunity on how they could better engage their associates and save their company money. So first things first, what's the client experience look like? If you think about it, and you look at these 2 items, left and right, the left is a multi-vendor program. In order for population management to work, you need all the items on the left working properly and working in real time. Claims analysis and analytics, a wellness vendor, a health coaching vendor, a disease management vendor, clinical support hotline, incentive management. All these items make up a holistic population health management program. And if you had to buy all these items, you'd be in the neighborhood of $10 to $15 per employee per month. The challenge here, there's limited engagement. It's near impossible to integrate the variety of different vendors and different data sets. And the incentive management, whether it's carrots or sticks, it's difficult to measure. And success, when we ask our HR clients or CFO customers, the answer they get is, we think it's working. We're just not really sure given all the spreadsheets that we have to combine. On the right side, and through our technology unit, Healthcare Interactive, we've spent the past 6 years and our own capital creating a holistic, single-source offering. Yes, the items you see, claims analysis, wellness, health coaching, disease management, clinical support, incentive management, are all bundled to be at a price point of just below $8 per employee per month. You get all of these items fully integrated and at a cost factor of almost 50% below of what you'd have to buy all of these independent solutions for. Like any good sports team or successful ensemble, the key to unlocking and achieving high value is working together. Visually here, this image shows a single source, fully integrated total population health management solution. Now, whether we're exchanging data with one of 100 different data partners like a carrier, like a PBM, like an ASO, or a biometric screening company, or grabbing data from the HRA and mashing both the HRA information, the screening information, any other claims data into the predictive modeler, it allows for the ability for us to get to those right people at the right time with that right message. That's what we call total population health management. From our experience, there's really 3 simple steps to achieve lasting results. That's integration that you've heard me talk about, automation of both processes, and as well as connection of the right people. Our health coaching model is clinically driven and scientifically based on the Prochaska Readiness to Change model. The processes are all embedded within our technology, so our coaches know who to work with and at what time and with the right message. The predictive modeling tools with Johns Hopkins are also fully integrated to create a holistic assessment of the moderate or high-risk members. The overall ability as it's in this approach creates lasting change that works today and will be around for tomorrow. I'm going to hand the mic over to Judy Mueller, who's going to talk more about the customer analytics along with the member experience. Judy?
Thank you, Keith. Good morning, everyone, and thank you very much for joining us today. As we proceed through the overview, I want to talk a little bit about achieving lasting or sustainable health outcomes as the ultimate goal. It's our perspective that that really is only possible when we can customize our health coaching and member engagement on what we know about a specific member or the population at large. The opportunity to have a very comprehensive clinical view of the whole population, as well as those members within the population that are driving risk and significant medical expense, or have the potential to do so, really starts with data analytics. Data integration, whether it be health risk assessment data, biometric and screenings data, and medical and prescription data, really allows us a holistic view of risk at the population and individual member level. This provides clarity to us in addressing and managing that risk. In order to impact member health and medical expense, it really is important for us to be able to understand where a member is both psychologically as well as physically in their readiness to achieve a healthy behavior change. We need to understand what their perceptions are of their own health status compared to what we may actually see in their clinical data. And when we do comparisons of that nature, we typically see a pretty large gap in how healthy people think they are and what we're really seeing in their screenings, as an example. We need to know what the primary health issues and conditions are that are impacting the health of the population at large, and most important to the consultant and the employer, what's the potential cost impact going to be to the medical plan? The integration of data allows us an opportunity to not only customize programming, but provide the consultant and the client a HIPAA-compliant, very comprehensive view of what we're seeing in the analytics, as well as the opportunity to use that analysis to make informed decisions about the plan design, incentives, and customized programming that will target specific population health issues. Up-to-the-minute data analytics and reporting can be viewed through the WellNet 4.0 online active reporting portal, which can be accessed on demand, as well as aggregate data regarding coaching activity, wellness scores, clinical outcomes, incentives impact, and success stories provided in the comprehensive Performance Insight reports. We've talked about the client experience, and now let's explore a bit about what our members experience when they work with us. Studies indicate that one-to-one health coaching, that high-touch approach to member engagement, is the most effective way to affect behavior change. Our health coaching model integrates both wellness coaching and clinical care management, and it's provided by our own registered nurse health coaches. The model is holistic in that one RN health coach can serve the needs of a member, whether that member is relatively healthy and just needs some encouragement and support, or the member is challenged by a number of medical conditions that are really difficult to manage. We can communicate with members at the work site, online through the member portal, or telephonically. The member engagement process is customized, and it's based on what we see in the clinical data as well as what we know about the member's readiness to change. The scientific principles that the readiness to change model is built upon is actually embedded in the very scripting and workflow that our RN health coaches use during the member engagement process. Over time, the readiness to change model has been proven to be 20 to 50% more effective in achieving that ultimate goal we talked about earlier, sustainable behavior change and healthy outcomes. Creating excitement and anticipation around the launch of the program is critical to a positive member response. We appreciate the opportunity to have a letter or a communication sent out by the CEO or the CFO is really a great way to start. And we've seen very positive reactions to our programs when that communication has been a part of the initial strategy. Our welcome kit then is sent as a follow-up to that letter or communication, which includes a welcome letter of our own, a quick start guide on how to access the portal and all the tools and resources that are available therein, as well as the ever-popular refrigerator magnet. These materials can be provided in Spanish as well as multiple other languages as needed. Our coaching model is structured to serve the needs of each member we work with. And as you might expect, everyone is unique in their needs and expectations. Whether we're working with a low-risk member who simply needs some cheerleading to lose some weight, a moderate-risk member who's just found out that his cholesterol levels are way out of control and has no idea what to do next, or a high-risk individual who's challenged by multiple medical conditions, our RN health coaches will adjust and customize the engagement to match what the member needs and is willing to do. Similar to the client comprehensive report we shared, the members receive one as well, a full report that aggregates their specific risk profile, health risk assessment results, screening results, wellness scores, as well as a detailed action plan built around where that person is on their readiness to change scale. The action plan can be implemented by the member on a self-directed basis, or the member can work with an RN health coach on a one-to-one basis to help direct and guide as they move along through that process. And now I'll turn it back over to Keith.
Thank you, Judy. When we look at population health management, we don't look at it as a one and done. An effective program really requires a multi-year strategy along with integrative incentives. We firmly believe that a sound incentive strategy, whether it's for a retail or wholesale organization, a distribution entity, engineering, every group has its own culture. They know how they like to communicate with their members, and they know what kind of budget they can actually afford and the requirements in terms of who they actually want to reach. Utilizing all of our data capabilities, WellNet helps our clients develop incentive programs in keeping with all of the clients' cultural, again, and budgetary requirements. So what's that look like? Incentives made simple. Many of our clients start out with cash incentives and ultimately end up with some level of gift cards or point systems or premium incentives. All of these things can be managed within our portal. And then really working in collaboration with our broker and consultant partners, we track, we manage, and we're continuing to refine these things along the way. Again, as I mentioned, it's not a one and done. All of this is managed, again, through the member portal. The key is relevancy. We've launched something new. It's called an incentive modeler. And taking a look at this model right here for a group of 500 employees, we've got two examples in the second and third column. What it shows us is what's more effective. What's more effective in engaging people? Is it carrots or sticks? In essence, is it dollars or is it taking items from them? What kind of participation can we get, which ultimately leads to what kind of return on investment can we actually receive? Prior to launching any population health management program, for us, it's about putting a schedule together. Yes, we have a one-year schedule, but we really run ours out 2 and 3 years. Each client is provided what's necessary, not just for the entire group, but items that are specifically targeted, challenges specifically geared towards moderate or high-risk members. In essence, what are we going to do today, but more importantly, how do we sustain this type of growth in terms of an effective program for tomorrow? WellNet provides a suggested roadmap. All kinds of various customizable program materials are available, from a custom starter kit to group challenges, telephonic coaching, on-site programming. All of these items are available when we start with a client and on an ongoing basis, as well as being in a variety of languages, including in Spanish. As many of you know, we've spent years refining our program, and one thing that our clients and our broker partners continue to tell us is that the program works. Whether it's for a union organization with several thousand employees or Viking Range with about 800, our ability to engage the right people at the right time is critical. If you look at Union 1181, the transit union, their members that we've identified that need engagement versus the ones that we've identified that unfortunately we've been unable to engage are spending 30% less per member per month, which is coming out to be about 10% less on per member per month cost over a 12-month aggregate period, and many examples just like this. So how do we support our broker and consultant partners? Over the past 2 weeks, you all, along with our team, have seen a bunch of articles about many clients being unhappy with their broker representation or the uncertainty about the role that the broker actually plays in the future of their program. However, as I've seen firsthand, when you continue to bring best-of-breed programs, proven solutions to your clients and prospects, you do two things. You retain that client business and you grow your business. WellNet has a full suite of marketing materials, teaching materials, case studies, white papers, articles, you name it, we have it. Whether you'd like us to do what's called a pre-sale analysis to analyze a client's claim data, in essence a try before you buy, or a dedicated teach-in for your team or for your clients or prospects, our group is ready to assist. And while we spent the past 20 minutes speaking about our population health management program. Given the challenges that the groups under 250 employees have been having, and also picking up from last month's webinar, our small group health plan has gained a significant amount of traction both from CNBC and the Wall Street Journal. And what that program looks like for groups, again, under 250 employees down to about 10, it's a self-funded or a level-funded plan where we've packaged up an offering that looks and smells like a fully insured plan. So the plan has a medical network, it's got pharmacy benefits, it's got stop loss to protect the organization, to limit that liability, it's got our technology, but what it really also has is it's got that integrated population health management program, from the incentive management, screenings, coaching, all the analytics. What makes this program so unique and why WellMet and our partners are getting traction are three items. 100% of the savings are going back to the client, not just a portion, but again, 100%. There's 6% commission for our broker partners. And again, it's that integrated population health management that gives clients insight and understanding, not just to save today, but the ability to save tomorrow. It's critical right now, given what the increases that are coming from the fully insured carriers, as well as requirements that are coming from ACA. Sustaining an effective workplace wellness initiative, no matter how success is defined, requires, again, a collaborative effort at every stage of the life of the program. Leveraging real-time information and high-touch, high-tech engagement, we look forward to partnering with you and getting to know new members as we continue to offer our population health management program. We appreciate the time today, and now we're going to take some questions that are coming in. In addition, should you wish to submit proposals for our population health program, the contact information is on the left at pophealth@wellmet.com. And should you wish to submit proposals for small groups, the contact information is on the right. The population health management program is typically for groups of about 300 employees and above. And our small group health plans are for groups of about 10 to 250 employees. I'm going to go to our list of questions. I see that we have a bunch. First question, and I'm going to direct these to Judy. How long, or how do you define member engagement?
Member engagement is actually defined in collaboration between the registered nurse health coach and the member. And what I mean by that is when that initial outreach is done between the RN and the member, one of the first things they'll do is talk about what the member's goals are. And the length of the time that the RN health coach works with that member will be governed by the number of goals the member wants to reach, where they're at in that readiness to change scale I talked about earlier. So we don't put any limitation on the time frame that an RN health coach can work with a member. Our member engagement is very customized, and it's rather intensive. So it does take time to build that trust level between the RN and the member. And so putting a time limit on that would not serve the member well, and it wouldn't serve what we want together with the member as that achievable outcome.
Terrific. Thank you, Judy. Another question, are there on-site lunch and learns and other challenges, such as walking fruit and veggies included in the base cost, or are those an extra charge?
It depends on the level of the activity in place. We do offer a number of what we call healthy living seminars at the work site. There may be some travel expenses incurred relative to having an RN health coach come to the work site and provide those opportunities. In terms of health challenges, they can actually be structured in a number of ways. They can be structured right online through the member portal. Again, they can be self-directed, or we can help a group of people structure a health challenge at the work site in a team fashion if they so choose. We have a number of different health challenges to select from, and we may recommend some based on what we're seeing in the data that we feel would work the best for that population. Again, additional fees may be incurred relative to that type of activity depending on travel and so forth.
Thank you, Judy. Next question. Do you have to purchase a level-funded premium plan to access this program? You actually do not. So we have two items that we offer. In today's webinar, we're talking about our population health management program, which can be purchased independently. And again, that's for typically groups 300 employees and above. But the level-funded plan that we also do offer, our small group health plan, comes integrated with this population health management program as well. And that's for groups about 10 to 250 employees. Next question, what TPAs other than Aetna would WellNet work with to incorporate this program? So WellNet works with a variety of TPAs and carriers. So if we are offering our population health management program to companies 300, 3,000, or 20,000 in size, and they have a carrier-based program where they're with a TPA, we can incorporate or integrate our offering into them. Next question. How do we work with a carrier-based disease management program? Judy, you want to hit that?
Mm-hmm. What we optimally like to see is the carriers program carved out, if you will, because of the integrated model that we use on the health coaching side. If you'll recall earlier, we really combine in the form of one RN health coach the opportunity for that person to provide wellness coaching, which everybody is pretty familiar with, but also be able to provide clinical care management, which is more in line with what we know as disease management. So we really are able to provide the whole spectrum of that within the context of our population health management program. If, in fact, the carrier insists on retaining that program, or it is the employer's choice to do so, we will make sure that anything that falls within the trigger list that they utilize gets referred back to them through our program. But, and it is a bias, of course, the success and the impact of our program is optimal when everything is integrated together.
Thank you, Judy. Next question. Is the presentation going to be emailed? Yes, absolutely. Both the presentation and some supporting items will be emailed shortly after this presentation. Next question. What type of reporting for health coaching is provided? Are outcomes illustrated so senior management is aware of the impact and behavior change as a result of the coaching? Judy?
That level of reporting is provided. In fact, clinical outcomes is really one of the hallmarks of the reporting package that we do provide. Other items that are included in that package that support clinical outcomes will be health coaching activity, the levels of member engagement, participation rates. One thing that we like to report on is what we call time 1, time 2 outcomes. So as an example, if we've done a biometric screening, we have results as a baseline, and then when that screening is repeated, we're able to go back and make a comparative report against any changes or positive changes that we saw in the outcomes over time. That level of reporting is included in that insight report I talked about earlier. So it does cover the gamut of everything that we do. We're very heavily into metrics. I hope you got that sense as we went through the overview for you. And it's one thing to have the data and analytics, and it is another to make sure that we report that often and very credibly back to our consultants and clients.
Thank you, Jude. And the next question, it's part 1, and I'll add a part 2 to this. It says, does reporting include ROI calculations? And then my part is, how do you measure those ROI calculations?
We do measure return on investment. The ability to do that credibly will be based on the opportunity to look at medical claim data. Return on investment has a number of different components built into it. We typically, I think we'll all are in agreement that it reflects a hard dollar value as opposed to some of the soft dollar reporting that might be done as well. So we look at things like per member per month cost, utilizing the same population one time to the next. We look at the number of admissions per 1,000 and bed days per 1,000, the number of emergency room visits. We look at the percentage of preventive services utilization within any given group. We look at engaged versus non-engaged, as Keith pointed out. So we look at the per member per month cost for the people that say yes to us and participate fully in the program against those where we've either not had an opportunity to or have outright declined our services. Return on investment is always the million-dollar question, and it's a good thing, clearly, to do and to report on because it does, it's a proof source for the impact of the program. I think we do a good job at it. I think we look at the right elements in reporting return on investment. A 2-to-1 or a 3-to-1 return on investment can signal a very impactful wellness and population health management program. But it does take time to get the data in and to look at the data, and it doesn't happen instantaneously. But because of the amount of data we get in and the way that the data is analyzed, I believe that we're able to at least begin looking a little earlier than most wellness companies do at trending and reporting that back.
Thank you, Judy. And just to close out this conversation, if you think about it, as your clients begin to ask you this season for wellness and disease management solutions, and yes, they want to do biometric screenings that they want to add on to a carrier-based program or what have you, when these items are out there, and in essence many independent, as I mentioned, single source solutions, if they keep getting added on, they're in essence like putting a Band-Aid onto a program. Unless you have something that is integrated and automated and connected to be able to touch those right people at the right time, it's going to be very difficult to be able to measure the success of the program. And what we found is many companies have come back to us after looking at us last year and saying, you know, hey, listen, you told me what was going to happen and it did, so that's why I'm signing up for you this year. We want to make sure that companies are best positioned, and you all specifically are best positioned to bring a better solution as we head into 2014 than in years past. And so Wellness fully integrated Pop Health does just that. We look forward to having the opportunity to serve you, work with you, and provide you any type of proposal information that you may need. And as mentioned before, all the information that we share today, both the presentation reviewed along with supporting items, will be followed up shortly in an email. Thank you very much. Bye-bye.
Thank you.